Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Etanercept. Its brand name is Enbrel. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Etanercept. We'll then touch on examples of dosing and finish it off with side effects. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Etanercept is a dimeric soluble form of the P75 tumor necrosis factor, or TNF, receptor that specifically binds TNF alpha and TNF beta, rendering TNF biologically inactive. In terms of indications or reasons we would prescribe this medication to a patient, well, Etanercept may be used for chronic plaque psoriasis or active ankylosing spondylitis. As well, this medication may be used in patients who suffer from psoriatic arthritis, rheumatoid arthritis, as well as juvenile idiopathic arthritis. With respect to contraindications or reasons we would not be able to prescribe this medication to a patient, well, we first off wouldn't give this medication to a patient who had a hypersensitivity to Etanercept or any other component of the formulation. As well, if a patient had sepsis, they would also not be able to use this medication. Now for examples of dosing with Etanercept. So in the treatment of psoriatic arthritis, we would typically see 50 milligrams given subcutaneously once weekly. For chronic plaque psoriasis, if it was moderate to severe, we may see an initial dose of 50 milligrams subcutaneously twice weekly for 3 months, and then a maintenance dose of 50 milligrams subcutaneously weekly. As with all medications, there are some side effects or adverse reactions that patients may experience while using Etanercept, so we'll go over some of those here now. Some patients may experience an injection site reaction. Depending on the dosing and what you're using it for, you may see this reaction happen 15 to 43% of the time. As well, some patients may experience an upper respiratory infection. This can happen in 38 to 65% of patients. More serious side effects may include congestive heart failure, aplastic anemia, leukemia, tuberculosis, or an infectious disease. Alright everybody, that's all we're going to talk about today with Etanercept or Enbrel. As always, I'm very thankful you took the time to come by and watch my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.